I've been accused or said that I knew Stephen F. Austin, and that's not true. I knew his brother. My name is Paul Kennedy, and I'm a pediatric dentist, and I appreciate the opportunity to be here today to talk to you. I am pretty old here. I did start practicing in 1969, and I have worked on behalf of children at my local level, at the state level, and at the national level, advocating for children's oral health and the Medicaid program. I met with Medicaid people in Washington and have looked at programs all over the nation. And also I have participated here in the state when we had the Frew lawsuit and the settlement of the Frew lawsuit. But since y'all are all young people, I want to give you a little bit of history, and just real quickly, because it is a late hour. When Medicaid started in the early 70s, the reimbursement rates were set at 75% of the usual customary fee. 30 years later, about 2005, it started about 1975, the reimbursement rate was 20% of the usual customary fee. And at that time, then, all the providers, most of the providers in the state had dropped out because of the reimbursement rates. And there were only about 400 of us who were seeing children on a regular basis. Well, most of you probably remember in 2007, the state came to an agreement on the Frew case and agreed to raise the rates. I was sitting at the table to help set those rates when we were there. And I want to congratulate the state and the commission, because Texas is an exemplary state, is recognized as taking very good care of the children. We actually have more children being seen on a regular basis in the Medicaid population than in the private population, which is remarkable. And
sir, just hold on just a second, Chairman. I'm sorry, and sir, just to clarify, you're talking specifically on dental, right?
On dental, specifically on dental.
I just want to make sure when you're saying things.
Specifically on dental, yes. And the amount of decay, the amount of disease in these children has been recognized as decreasing significantly over the term of this 10-year period of time. Well, let's look at what's happening now. That was 2007. I think in 2008 we had a 1% fee reduction. 10 years later, at an inflation rate of 1 to 2% a year, we've lost another 10 to 15% on the reimbursement, even though it's supposedly at the same level. So we're down and at about 35 to 40% of what really is the reimbursement level. And now this will be about a 9 or 10% reduction if this goes through. And that is going to put us back down in the 20s where we had started with our problem before. So we're going to lose providers, and the Medicaid program will be back in the same situation it was. Now, what made this program work before is that we sat down and we went over the different codes that were needed. There were a lot of codes in the Medicaid system. A lot of those are not used much. And I'm going to propose today, and I'm not sure whether this group has the authority or the commissioner has the authority, but we would like for a group of dentists to meet with the commission, go over the rates, explain why the ones that they're proposing to change won't work and will actually drive dentists away, and work with them to come up with a compromise that we think will work. Even though we understand we're going to need to cut, we think we can come out and with a workable program that works for everybody.
So do you mean, I guess, did you testify, we had a hearing at the commission yesterday, right? Did you go testify at HHSE?
Yesterday, yes.
And did you lay out what your ideas were?
The program's not long enough. You need about a 4-hour, 6-hour session to explain all the codes. And I will need to bring some of my associates, my friends in to explain that. But
So it's your position that you're saying that, I guess that, and I'm sorry, Commissioner, I didn't hear your layout. I had to be at another meeting down, but the other side of the Capitol. But you listened to his presentation. He talked about what kind of reductions, and you already know what kind of rate reductions we're talking about.
yes, and my understanding, I could be wrong, but my understanding, the only input that was in those suggestions came from his administrative staff, because yesterday was the first time that I know of that any dental input was made.
And remind me when we're proposing these new rates. That you'll
October 1st.
Okay, and if you know if they'd be willing to meet with you and a few other people, I'm trying to understand what you're saying, which is you're not.
We don't. This is going to cause a failure in the program, the dental program, and in order to make it work, we need to meet with the commission. We need to understand what they're trying to do, and we need to tell them what will work and what won't work. Because we've looked at their codes and the rates they have for those codes, and they won't work. They'll drive dentists away.
Okay. Well, I'll have the commissioner back up in a minute. We'll talk some more, I guess.
Okay.
Mr. Miller or somebody, Mr. Frank.
I just want to clarify something that you said earlier. The usage of dentistry is higher in the Medicare patients or Medicaid patients or the children than in private pay. So we have more kids going to dentists who are uninsured than we do other kids. I'm probably not saying that right, but is that what you
Yeah,
said?
I think, yes. More children in the Medicaid program are accessing a dentist than children in the private population.
A higher percentage? What?
It's like 65% in the Medicaid population and like 55% in the general population.
Now, is that the same with preventative? I mean, are you talking principally with preventative, or are we talking some of the higher end braces and?
This is the preventive. Well, it's just how many children actually see a dentist once or twice a year. And we have more children in the Medicaid population that are accessing dental care than in the private population that are accessing dental care.